and welcome back to The Progressive Voice. In our last episode, we broke down what infrastructure is and what it looks like. We learned that infrastructure is more than fixing roads and bridges. We need to repair and rejuvenate many areas in NEPA, such as jobs, childcare, and broadband, to name a few. In this episode, we are going to focus on healthcare, identifying areas that need improvement, and how we could properly support our local healthcare workers. To gain more insight, I sat down with State Representative Bridget Kozarowski, representing the 114th Legislative District in the Pennsylvania House of Representatives. She is the first woman to represent Lackawanna County in the General Assembly in more than 50 years. Kozarowski has spent her professional life in the healthcare sector, working as a registered nurse. For more than 25 years, she helped patients live long and healthy lives, while also witnessing families struggle to afford quality health care. As a mother who has raised a survivor of a devastating diagnosis of leukemia, she knows firsthand the hardships that too many families face. Let's take a look. Hi, Bridget. Thanks so much for coming on The Progressive Voice.
Of course, and I'm thrilled to be here. Thanks so much for having me.
As a nurse, how is healthcare considered infrastructure?
So that's a great question. Often in Harrisburg or even in Washington, conversations around infrastructure consist of people thinking about roads and bridges. And that is a part of it. We look around and it all needs to be improved, certainly in those arenas. But as a nurse, certainly infrastructure, when I think about it, it means structure or foundation. That every and any organization requires structure to properly function. And the healthcare system is no exception. Healthcare, by definition, is the organized provision of medical care to individuals or our community. And in order for us to provide that proper care, the structure needs to be sturdy. It needs to be fully functioning. And that means proper investments to pay for our healthcare workers. That means investing in telehealth medicine. It means making sure everyone has access to affordable healthcare. It means making sure no one is choosing between receiving healthcare treatments versus, buying food. And that means investing funds to train and pay our care workers. When I think of infrastructure and healthcare, that's where we need improvement.
How has the pandemic exposed the flaws in our healthcare system?
Believe me, as a nurse, and I've been a nurse for a long time, these cracks have been around and flaws have been around for many years. I can't remember a time working in a full shift and actually, taking a full break. There was never really a time that I, in my world of nursing, have ever felt like I was overstaffed or even, sufficiently staffed in numbers. Our healthcare workers did not. The main thing is our healthcare workers did not have the proper tools they needed to combat the pandemic. That was exposed on day one. Healthcare workers right on the front lines were getting sick. They were burnt out because their colleagues contracted the virus. The world saw what happened to our nursing homes, the very place that cares for our most vulnerable population. They were completely dependent on the hopes the direct care workers that didn't get sick. And we have so much work to do before our healthcare system becomes flawless.
What do you see as the biggest needs for healthcare in Northeastern Pennsylvania?
Most importantly, I think we need to modernize technology, the technological tools and facilities, including electric healthcare records. We need to invest in telemedicine, which requires us to invest in broadband. I think often when people think of NEPA, they immediately think of the Scranton Wilkes-Barre. We've got rural areas like Sullivan County, Fell Township, Wyoming County. We have serious issues throughout the state with broadband. It's a domino effect that hurts telemedicine. I think we have a dire need to train and pay our direct care workers. And I think, we have a need for hazard pay. Now, these aren't just needs for NEPA, but throughout our state in general.
How could the American Rescue Plan support healthcare workers, and what could be done at a state level with these funds?
We received $7 billion of American Rescue Plan funding, And the House Democrats came up with a plan, and we called it the Pennsylvania Rescue Plan. I have a copy of it here. This was a plan on how to properly use that funding. And believe me, we had a historic plan to support our healthcare workers. Specifically with the healthcare workers, we had $511 million to train and pay our direct care workers, $15 million to modernize public health infrastructure, $25 million to have access to telehealth, to that healthcare for telehealth patients that need that. We had $75 million to invest in healthcare research and innovation, $250 million in hazard pay for the frontline essential workers, another $250 million to create paid sick leave and family leave programs, and so much more.
Stop right there. It's time for a yellow flag segment. At the Progressive Voice, our yellow flag segments are dedicated to help spot any misinformation or false choices. Ask any legislator why something can't be done to help people, and they'll probably say there just isn't enough funding. But over the last year, there were unprecedented funding sources: the American Rescue Plan and tax revenue. Billions of dollars came into Pennsylvania from the federal government to help people recover from the pandemic. At the same time, statewide tax revenue was higher than anticipated, creating a budget surplus for the state. But what happened to these funds? $5 billion was put into a savings account called the PA Rainy Day Fund. Because of the pandemic, some of these funds could have been utilized for investments in business, public health infrastructure, support for families, and workforce development. But simply put, the funds are not being used for the rainy days we are having right now. It is up to us to hold the legislators accountable. You can call your representatives and encourage them to work for a real recovery for all Pennsylvanians. The dollars put into the PA Rainy Day Fund should have been used for Pennsylvanians out of the rainy days of a global pandemic. But it's not too late for them to give us an umbrella. That umbrella could include funds that help healthcare workers like Representative Kozarowski take care of us all. How do we build back a better healthcare industry?
I think most importantly, listening and respecting our healthcare workers, not just when we're in a global pandemic, but every single day. I mean, this happens when there's a crisis. We tend to focus on the immediate. There was a lot of attention on our healthcare workers, but we need to remember this is every single day. Investing funding properly, by not allowing big pharma to dictate someone's access to healthcare, but making sure we live in a society where a mother is not terrified on how she's going to pay for a child's medicine. In order to build back better, we have to break decade-long cycles that have put healthcare workers and patients' medical treatments secondary to profit. I know that it is not a quick process. It'll take time, but we have to stand up and try.
In order to rebuild a better foundation for our healthcare infrastructure, we must invest in it. Our NEPA community and NEPA healthcare providers for years have been asking for changes in pay, supplies, and support. Now is a critical time after enduring a global pandemic. Communities need the confidence that the government will work with the people and put them at the center of the recovery, especially with healthcare. We plan to continue this conversation, so please join us on our next episode as we talk about building a better broadband system in NEPA. If you enjoyed this episode, please like and share with your friends. We also have so much more on our website and would love for you to join us as a member. Please visit us at Action Together NEPA.org to become part of the Progressive Voice in NEPA.